SNS Institution, a multidisciplinary global institution and the first institution to implement design thinking curriculum in education. Our institution works based on a holistic 5-group building centers. The 5 pillars are Center for Learning and Teaching, Skill and Career Development, Center for Creativity, Industry Institute Partnership Cell, and Social Responsibility Initiative.
Hi everyone, myself Vickram.T. I'm currently pursuing Bachelor of Physical Therapy as a physician. Today I'm going to discuss about what is dialysis and the influence of artificial intelligence and data science in dialysis. Dialysis it means the process of purification by exceeding the basis from the body in our brain. But the kidney is affected by some diseases like AKI and CKD. The amount of toxic substance exuded from the kidney it will be reduced. So due to this kind of diseases, so the AI comes into role to take care of the patients who are affected by that. In the dialysis process, the 2 important things are the dialysate solution and the dialyzer. The dialyzer also known as artificial kidney, because what the kidney is going to do, the dialyzer membrane will go to do that. Okay. In India, we have 2 processes. Hemodialysis is the process of removing waste from outside the body by inserting needles in arteries to take blood from the body to dialyzer, and also by inserting needles in veins to return the blood from dialyzer to the body. Here you can see the picture of hemodialysis process. Now you can ask, so how the process is going on? The process was done by the dialyzer and the dialysis solution. Dialyzer, it is a round tube structure which is extended placed in a dialysis machine. It is made up of polymorphine material with a lot of spores, like what we have in a glomerular filtration membrane. The polymorphine sheet acts as a semi-permeable membrane. With use of this, the filtration will occur. The dialysis solution, which is made by using these 2 equipments and principles like diffusion and ultrafiltration, the whole dialysis process is going on. The principle of diffusion is from higher concentration to lower concentration. By using this principle, the whole dialysis process is going. The semi-permeable membrane filtered all things except the plasma proteins due to the large molecular size of plasma proteins. In our blood, the potassium concentration is high, but it is low in dialysis solution. So the potassium concentration diffuses via semi-permeable membrane from blood to dialysis solution. By using this principle, all other electrolytes are diffused from blood to dialysis solution, and also diffused from dialysis solution to blood. After that, the blood comes out from the dialyzer and then it goes to the pressure monitor to determine the pressure of venous blood pressure. And then it goes to the air trapper, because if case the air bubbles present in our blood, it even leads to the death. Then it goes to the vein. This dialysis solution is collected from the dialyzer and then it is filled in can. Peritoneum dialysis. Peritoneum dialysis, another form of dialysis. In this method, we can do dialysis in our home by ourselves. But in this method, we need a surgery, a minor surgery. In this method, we need surgery, this minor surgery. Okay. By inserting a catheter tube, by making a hole nearby umbilical cord, and inserting a catheter tube inside the hole to the peritoneum membrane. The peritoneum membrane acts as a semi-permeable membrane. By using of that, the ultrafiltration will occur and diffusion will occur. The dialysis solution will injected through the peritoneum membrane via the hole, the catheter tube. After dialysis, the waste dialysis solution is taken out from the body by the same catheter tube. This process takes 4 to 5 hours. During this process, you can walk and you can do your daily activities. The major difference between hemodialysis and peritoneal dialysis are: hemodialysis, you want to need a dialysis machine, so you want to go to the hospital to take dialysis. But in peritoneal dialysis, you don't need a machine, so you can easily dialyze in own by ourselves. That's the thing, the difference between hemodialysis and peritoneal dialysis. Now we are going to discuss about the hemodialysis and AI. The most important implication of AI in HD is related to dialysis services. Generating auditing system powered by AI and by ML algorithm seems to be improved major outcomes. In a retrospective trial, 5,800 dialysis sessions from 43 patients supervised for 19 months were assessed. Through temporal data, mining techniques to gain insight to cause for unsatisfactory clinical results. Quality assessment was based on the
automatic measurement of 13 variables reflecting significant aspect of dialysis session, such as the efficiency of protein catabolism, product removal or total body water, TBW. Reproduction and hypotension episodes. Based on the stratification of different causes of failed dialysis in time, ML algorithm, learned association and temporal rules reporting risk profiles for patients containing typical failure scenarios. Due to neural network, we are now able to exclude the bias of dialysis center effect on mortality, the residual difference in mortality probability that exists between center after adjustment for other risk factors. In a study including 18,000 ESRD patients from UK renal registry and MLP multi-layered perception was trained and then tested for predicting mortality. The other proved that high accuracy that the renal center characteristics show little association with mortality and created a predictive survival model with a high degree of accuracy. To have a real perception of what being data means, we present a study encompassing dialysis patients from the US or DS. A total of 112,649 records were included in combined dataset, 42 variables being selected to be used in the analysis based on their potential clinical significance. The other described a feed-forward NN with the two inputs, one output and a hidden layer containing 4 neurons. A powerful tool was created to predict mortality with high accuracy. In daily practice, clinical nephrologists could also use forecast models that can predict the quality of life changes through an early warning system, performing dialysis data interpretation using classification tree and native and cardiovascular outcomes model and an RF model were developed and used for predictive comparison of data from 4,246 incident HD patients. Probably the most attractive templating field is the HD session. An actual dialysis machine cannot adapt react when various changes occurs only. AI may lead to personalized precision medicine. Indeed, a recent AI model was able to predict hypotension and anticipate patients' reaction. Since the NN approach is more flexible and adapts easier to complex problems compared to standard registration models, the others include 60 variables characteristics, the historical record of physiological reaction outcomes of previous dialysis sessions, pre-dialysis data, and the prescribed dialysis dose for index session. The data set used for modeling consisted for 76,06,000 records, each representing a dialysis session recorded in the Spanish neurocare centers. NN provided to be a predictor that an standard recommendation from the guidelines regarding the urea removal ratio, post-dialysis, BUN or KTV by V. ML algorithms were used to predict low blood pressure, blood volume or TBV. Since anemia is a frequent comorbidity found in ESRD and dialysis patients, key elements were targeted by AI software, erythropoietin stimulating agents, hemoglobin targets, and iron treatment dosing. An impressive recent retrospective observational study including HD patients for Portugal, Spain, and Italy from 2006 to 2010 in French's medical clinics. At every treatment, drabopoietin alpha and iron dose administration was recorded as well as parameters considering HD treatment. The data represent the input of training and testing a field-forward multi-layered perception (MLP). This approach puts together the potential of MLP to produce accurate models given a representative dataset with better use the availability of information using a prior knowledge of RBC lifespan and the effect pronounced by the iron and ESA. Other studies also use NNs to individualize ESA dosage in HID patients with outstanding results. Moreover, NN implemented in clinical wards could appreciate erythropoietin repositories. Probability. The most advanced system to manage anemia in HD is the Anemia Control Model (ACM). Conceived and validated previously, this model can predict future hemoglobin and recommend a precious ESA dosage. It was deployed in 3 plat clinics as part of routine daily care of large population of unselected patients. Also, a direct comparison between standard anemia management by expert nephrologists following established best clinic practices and ACM supported anemia management was performed. 653 patients were included in the control phases and 640 in the observation phase. Compared to the traditional management, the AA approach led to a significant decrease in the hemoglobin fluctuations and reduction in ESA use with a potential to reduce the cost of treatment. AA algorithm also improve chronic kidney diseases, minerals and bone disorders management in HD. Some studies suggest that NN, based on limited clinical data, can accurately forecast the target range of plasma IPTH concentration. An MLP was constructed with 6 variables corrected retrospectively from the internal validation group n equal to 129. Plasma IPTH was the dictonymous outcome variable in the target group. After internal validation, the AN was prospectively tested in an external validation group n equal to 32. This algorithm can repeatedly perform the forecasting tasks and may be a satisfactory substitute for laboratory tests.
I thank my principal sir, staffs, vice principal sir, correspondent sir, technical director for giving the wonderful opportunity for CLT. And once again, I thank you. Thank you.